So we're going to be thinking about Godtfredsen syndrome, which is the combination of two cranial nerves, cranial nerve 6 and cranial nerve number 12, described by Dr. Godtfredsen, of course. And what you need to know is a little bit about the anatomy of these nerves. They're numbered for a reason, because 3 leads to 4, leads to 5, leads to 6, and 6 lives next to 7, 8, and 9, and 12 lives next to 11 and 10. And so you would think it'd be hard to make a cranial nerve 6 and a cranial nerve 12 from a single lesion, a structural lesion. However, there is a place that can occur. And so if you're looking at your pons and your brainstem, superior colliculus, inferior colliculus, third nerve, fourth nerve just go straight across to the eye. But in the pons, the 6th nerve starts very low, and the 12th is way down here in the medulla. And so the 6th nerve has to get up to the eye. It's anchored here in the root exit zone before turning into the cavernous sinus here. And the name of that bone is called the clivus. That word means slope. So you can imagine just skiing down the clivus. So when you have a 6th, that could be a clival lesion. Of course, cranial nerve 7 and 8 are exiting laterally because they're trying to get away from the brainstem to their target organ, which is lateral, the ear, or out to the face through the stylomastoid foramen. And the same thing for 10, 9, 10, 11, and 12. Only 12 is staying on the clivus because the hypoglossal canal is very close to the tip of this clivus. So when you have a clival lesion, it's often only a 6th. But if it's a 6 plus a 12, for sure it's clivus, because how'd you jump from 6 to 12 without getting those other cranial nerves? And the reason that happens is all those other cranial nerves are exiting and going laterally, and only the 6th is on the clivus, and only the 12th is in the close enough to the midline for a 6-12. And therefore, a 6-12 is a Godtfredsen syndrome, a syndrome that localizes to the clivus. Usually that's a mass lesion, and the things you got to think about are what's in the clivus: chordoma, chondroma, meningioma, chondrosarcoma, metastasis, plasmacytoma. But it really doesn't matter. The combination of 6-12, you should scan it. It's called the Godtfredsen syndrome, and you're going to be scanning the clivus.